Sternum. The sternum is a flat, elongated bone located in the midline of the anterior thoracic wall. It forms the front of the rib cage and protects vital organs such as heart, lungs, and major blood vessels. It articulates with the clavicle and the costal cartilage of the rib. Parts of sternum, Manubrium, upper broadest part of sternum, has a superior depression called the jugular suprasternal notch. On each side are clavicle notches for articulation with clavicle sternoclavicular joint. Articulation with the first rib and a part of the second rib joins the body at the sternal angle, angle of Lewis, an important clinical landmark. Body, Gladiolus. The longest portion of the sternum forms the fusion of several segments, vertebrae. Provides attachment of the costal cartilage of rib 2 to 7. Its lateral border contains costal notches. Gyphoid process, the smallest, most inferior part, may be pointed, bifid, or curved. Remains cartilaginous in youth and ossified in adulthood. Several as an important landmark for CPR or abdominal anatomy. Muscle attachment to the sternum. Pectoralis major originate partially from the anterior surface of the sternum and costal cartilage, acts to adduct, flex, and medially rotate to the shoulder. Sternocleidomastoid, the sternal head originates from the manubrium, function in the neck flexion and rotation. Sternohyoid originates from the posterior surface of manubrium and depress the hyoid bone during swallowing. Sternothyroid originates from the posterior surface of manubrium, depress the larynx. Transverse thoracics arise from posterior sternum, help depress rib during expiration. Diaphragm. Some fibers originate from the gyphoid process. Blood supply. Internal thoracic artery branches. Nerve supply. Innervated by intercostal nerves. Pathology related to sternum. Sternal fracture, as usually due to the direct trauma road accident. Costochondritis, inflammation of costal cartilage near the sternum. Tietz syndrome, similar to the costochondritis but associated with visible swelling, common in young adult. Pectus excavatum, congenital depression of the sternum, funnel chest, may impair cardiac and respiratory function. Pectus carinatum, forward protrusion of the sternum, pigeon chest. Sternal osteomyelitis, infection of the sternum sometimes after the surgery, sternoctomy, cause fever, pain, and redness.